All right. Good morning, good afternoon, good evening, everyone, and welcome to this fifth session of the TechNet 21 webinar series on deploying an electronic LMIS, making the right choice. I'm really happy to welcome our guest today for this session, the topic of which is introducing Medexis LMIS software and services. Today, we have with us four panelists, as Per was saying before, from iPlus Solutions. We have Landry Médégant, Senior Technical Advisor, Supply Chain and Country Representative in Burundi. Per Kronzlev, Senior Supply Chain Consultant, Katie Johnson, Program Manager, and we might have Ed Munchen, the CEO, coming later. I'm not sure if he's going to join, but he might be with us. We'll start with an introduction of the tool for the first 15 minutes or so. Then Landry will present the Burundi case study. We'll finish this session with questions and answers. So you can ask your questions during the presentation in the Q&A box or in the chat box. They will be answered by the panelists after the presentation. As usual, this session is recorded and we'll share the links to the video as well as the slides by email and on the TechNet 21 websites. And Per, the floor is yours. Thank you.
Thank you very much, Alex. So I am talking from iPlus Solutions, and we have this software named Medexis. Next slide, please. I will start with the background, something on the design, the features of it. Then Landry will come with the implementation from Burundi. Yes, and in the end, we'll have questions and answers. Our software is, well, the background is that we are a company that we are a very large procurement agent for the Global Fund. We do a number of countries, many countries for Global Fund. And we have also our downstream activities. So we do in-country system strengthening in Burundi, DRC, Mali, and Nigeria. So that's iPlus. Let's go to our software. Next slide, please. The history of Medexis is that we, in 2017, had worked a lot with this and chose to make a new software and base it on all the experiences we've had until then. We wanted to solve these structural challenges that remains in all these countries. Next challenge, please. We have issues here of data visibility, accuracy, in this whole supply chain. And as many of you will know, we have a big need to get cultural, to get this data in line and get it in a digital format. Please take next slide. Medexis is an eLMIS. So it is made specifically to solve the eLMIS challenge. It is easy to use, it's cloud-based, Android-based, made for environment with low bandwidth. It's absolutely an LMIS. It's available as a software as a service, and it can be integrated with other mechanisms. Next slide, please. I will now go through our different features in our software. We're having forecasting and demand planning. It's based on simple algorithms where we calculate things. We calculate the average monthly consumption. Based on that, we do the forecasting. You can go in and check. You can go in and regulate your forecast. It's all very transparent and understandable for the users. We have lot management, first expiry, first out. We have, of course, also the FIFO. First in, first out. It depends on you, what you want and what you need. You get full traceability of your batches and expiry dates and so on. Next slide, please. You got an intelligent inventory management. What does that mean? That means that you can track your products by donor. For instance, the Global Fund or whatever donor, you can track it by program, your HIV, your TB program. You can track it, of course, by funder. You can see what's the unserviceable stock, what's in quarantine. You can see it by bin location, by warehouse, and so on. You can also do stock rationing. if you're having less stock than people need, then the software will help you to divide the stock. Okay. We are now moving. Okay. Now this one, we're having real-time stock visibility. You can see the stock status. You can see the order status in real time. We have an informed push and pull fulfillment process. What does that mean? It means that you can ask the software to, of course, you can do a pull. That means the health facility makes an order and then it gets the product it asks for. But you can also do informed push, where you let Medexis calculate how much they shall have, and then you ship according to those calculations. Next slide, please. We're having cold chain management integrated. This means that you will be able to map all your cold chain equipment, every freezer and fridge with their capacity. You can connect the remote temperature monitoring devices, the RTMDs, to the software. So then you can at a distance see if your equipment has the right temperature. You can also see the capacity in each freezer and fridge. And you can, when you distribute your product, you will be able to monitor and take care that you do not distribute more vaccine to a given location than you actually can hold in that location. We also have this, what's called the monitoring of the closed vials, the wastage. Those of you who do COVID-19 vaccinations will have this issue where you open a vial and you may or may not spend the whole vial, and you need to account for this. You can do this in Medexis. Next slide, please. We also have transport management, meaning that we do, we can, for instance, calculate routes. If you do milk rounds, you can tell it, I would like to distribute to these 10 health facilities. Then the software will calculate the best route to those health facilities and use it for this. It will capture the product consumption as needed at the last mile. We have an integration feature with DHIS2. That means that we are taking care that data can be going to DHIS2 and from DHIS2. And in addition to that, then we work with a model and an idea of bringing in data from the small health facility via the DHIS2 screens, which people anyway has out there. This is an important way to limit your cost for implementation and your maintenance and training. We do also have budget and credit management. So if your health facilities has a given budget, you can tell the budget and then they can order up to this budget. Next slide, please. Another feature is the ability to scan. So given your product has QR codes, or you can of course print the QR codes and have them next to at the facility, then you can scan the QR codes when you receive products at the health facility and when you issue products at the health facility. That will limit your human errors, and you can do the scanning with on a mobile phone with the camera. And of course also with a scanner. Our system is compatible with GS1 codes as well. Yes. Next slide, please. We have a number of dashboards with the KPIs, standard KPIs. Most of you will know, monitoring stock outs, stock levels, so on and so forth, and of course linked to the maps. Next slide, please. Another dashboard. This is showing the stock levels for essential medicines. How much is for essential medicines? How much for vaccines? How much is for immunization? You can get it by items, by value, what you need. Next slide, please. We can do stock out analysis. So how much stock out you have by location, which items are stock out, the duration of the stock out, like has it been a month, a few days, and so on and so forth. Very important. Next slide, please. Yes, I just referred to the milk run calculation. So this is a shipment monitoring. Of course, we can also monitor the individual shipment. So you can see that you have now issued a certain shipment. It's on the road. At some stage, it will be received, and so on and so forth. This is visible in the software. Next slide, please. We have the batch recall feature, another one. So if you need to recall a given batch, you tell the identity of the batch, and Medexis will tell you where it has gone. It will help you communicate to the health facility. They should send this one back. And of course, Medexis will not allow any more issuing of that given batch. Yes. Now, of course, the inventory regulation, if you have the right approvals, you can also be allowed to regulate your stock levels, of course. Next slide, please. The search functionality, you can search your information by product name, by item number, by health facility, and so on. So these various parameters. Next slide, please. So the implementation. We come with a quite small setup actually in ourselves, and when we implement via local stakeholders, so we engage a local smaller company to help us out. We work with and we work a lot with the local team of Ministry of Health, obviously. We have this concept of doing integration with DHIS2. What that means is that, for instance, for community health workers, who in a number of countries actually will be entering data into DHIS2 screens, we can pick up data, eLMIS data from them, and get them into Medexis, and then create an oversight over the supply chain end to end that way. So that's how we will use DHIS2 to minimize our implementation. So we might only put Medexis into the bigger health facilities and the hospitals, but not the smaller ones, not the community health workers, so they can remain just using the DHIS2 screens. Our implementation will, of course, involve some training for those who shall use the full Medexis. We'll be able to do implementation for those who do not use the full Medexis, where we pick up data via these screens to a much more limited level. Then our fee structure. Well, we got two fee models. One is the traditional one, where you have a payment per user, per facility, per year, as traditional. But we also have another model where the country pays a one-time the national perpetual license, and then that is the payment. So you can pay this one under your implementation project as part of your total budget for your implementation, and then you will not see any more cost for license. So that's our fee structure. Next slide, please. Yes, okay. So this was a quick, like 13-14 minute run through our features, how we work. Yeah, I would like to hand it over to Landry now. Landry, are you on?
Landry, you're on mute.
Yes, good afternoon. So my name is Landry Medegand. I'm originally from Benin. I'm posted now in Burundi, working on our eLMIS implementation. I work for iPlus Solutions now for 11 years. So let's us now go through our eLMIS Medexis implementation for Burundi. All started actually in Burundi back in 2013, where then we improved and contribute actually to improve the paper-based LMIS in country for reproductive health commodities only. And then after we have done this, the MOH requested to have to digitize the system if possible. We use as I+ solutions actually to do this kind of work before, where we were joining our forces with other software companies, you know, like Mongo, for example, in the UK, and then others, you know, who are still maybe who are also in the field. And then so we decided actually to design then our system then back in 2018 to respond to that need of MOH Burundi. And then we implemented quickly actually in 2019. And then where we test it and then see how it was working and how it was responding to the request. And then we tested to the reproductive health commodities because we knew more and good and much their supply chain. And then we, in 2020, the ministry requested to have nutrition product actually added to the product category we had. And then this is the reason as to why then we took it as phase 2, then added these commodities in it. And then in phase 3 now, we are now planning actually to onboard vaccines. Next slide, please. Yeah, then about the country experience here. Let me talk about the phase 1 and phase 2 in 2019, and then which comprise actually the reproductive health, nutrition products, and then a few vaccines, where then you can see here that we train people. When we introduced the system, we train people then through the entire supply chain. And then, so we started with the central medical store. There is one here, Kamebu, this is the name. And then where we train people, and then from there, we train also then, those people actually trained then the district people. So then, and then the health facilities. So we implemented this in 13 districts in total, out of 46 at that time, and now it's 47. And then also 233 health facilities out of 1,300. And then so we had to train first master trainers and then users. And then also then we were training them on the job as well, where we strengthen at the meantime their capability in managing such products, actually, not only dropping the system, but guiding them, accompanying them. Next slide, please. Yes, and then here you can see that we then start tracking actually the product flow and then the information on those product commodities, and then throughout all those health facilities and knowing exactly what is going on, what is happening, and then when needed, we help them to take actions. You know, and then we also then are now implementing a new module we developed, and this module is actually is an app, is an application which looks like rideshare solution, you know, like Uber, for example, whereby we then ask when there is a transportation, a product to be transported, we then to a certain number of health facilities, we put then the transport request in the app, and then a group of approved local drivers then who have a vehicle then can choose and then take on the job and then get paid as well, you know, after then the goods is delivered. You know, and then once it's confirmed, once the delivery is confirmed, then the app we provide the data on the last mile and then allow then payment of the driver. Next slide, please. Here about the results, we saw that about availability, for example, of products. We saw that once we after we have introduced Medexis, we saw the activity has increased. And that was good to see, because you can see that increase then from 85% to 99% at that time. 85% because of the fact that we went live actually just after a replenishment, so it was a challenge. We had to keep at least this high performance there, but we wanted to improve it actually. And then so we had a baseline conducted in October, back in October 2019, to understand then how what was going on, and then what we wanted also to address, because there are a lot of challenges, and then we wanted to work by priority. And here the availability rate was measured per 10 key products actually. Next slide, please. Then you can see in Medexis, this is what you see basically. If you open the system, you can see then where you can see facilities experiencing stock out situations, then in red, for example, and then at your right side, you can see some key performance indicators, so that at a glance, you see already where there are problems and then where you need to take actions. Next slide, please. Yeah, here about the results. The result here of our pilots about the stock out here, we see that after having introduced Medexis, we saw the stock out percentage then reduced, and that was from 94% then down to 8%. So meaning that 94% at the baseline time then was were experiencing stock out situation, 94% of the health facilities, and then now we manage actually to bring it down to 8% at the end of that pilot, of that phase actually. Yeah, and then it's important here to mention some things also that there is important, there are some prerequisites you need actually when choosing a eLMIS system. You need to, at that time we had, and now still we have a motivated MOH, Ministry of Health here, then who took actually the ownership, and also the support, they support also that work. And then because you need to have a strong governance and a leadership in place, this is key. And then you need also to have a sort of clear, defined and well-defined item numbers, a list in place, and that will come from your essential medicine list. And then you need also then a well-defined list of health facilities as well that you want to enroll in such implementation. And then you may need sometimes a functioning internet. That was a good lesson learned from us, for us as well, because we came into certain areas where internet connectivity was scarce and it was difficult to get connectivity. But then after this, in the new version we developed, or we upgraded actually, we now have the capability of working, offline, and that will simplify then this challenge some health facilities were facing, because they had to go between 5 to 18 kilometers in average actually to search for connectivity before then recording data. And then you need also acceptance, from from the vertical programs, because we see them a lot in countries. And then those vertical programs, you need to have them to the willingness actually to move from the paper-based, to then a electronic solution, and also something which is really key also is that the eLMIS you may want to choose then will need actually to meet your needs. Not the country to meet the needs of the eLMIS. So you need to make sure that the needs you have are measurable and then workable as well, and together you engage then the different stakeholders, in that. And then what we had also is that you need also to have to make sure that the eLMIS you're choosing then have the capability of interoperability for interoperability, with other ERP systems, because you may have already another system in place. This was our case here in Burundi, where we had Sage in Sage, then at Kamebu side. And then we seek interoperability with Sage, because we wanted Medexis to talk to Sage as well, and as well as DHS2 now, where we will then globally we have that interoperability already, and now we will make sure that we do the same in Burundi. And then the way forward here in Burundi is that we're gonna on the request of MOH, we're gonna expand to additional facility for vaccines here, then including COVID-19 vaccines as well, and then so that we can also track then the cold chain equipment, and Medexis is well designed for as well. And then we'll be integrating to those, we'll be adding those to those nutrition products as well. And then the data exchange we will make sure that that we fully integrate with the new system of Kamebu, because Kamebu has also upgraded the system, and now both systems can talk to each other without human human being between. And then we're gonna also work together with the DHS2, and then make sure that we integrate our system with DHS2, whereby community health workers, for example, or health facilities, will then report their data, record their data through a DHS2 screen. But then behind that screen, DHS2 will talk to Medexis, and then Medexis will talk back to DHS2 for data aggregation. Next slide, please. Thank you so much for your attention. That was what I wanted to share with you today. Thank you very much. Over.
Thank you very much, Landry. That was very interesting. We have a few questions, so let's start with some, well, with this one. Is your eLMIS system open source? Who could answer that one?
I guess I could take that one.
Of course.
Yeah, and no, it's not open source in the sense that we have a license fee, but we have this option where we have a payment for a license fee at the very start of the project, and then it's a perpetual license that will last the lifetime of the project. So when that has been paid in the beginning, then yes, there are no further fees.
Excellent, thank you. Before I carry on with the other questions, I just want to welcome Nuno Rainho. I'm sorry if I mispronounce your name. Who just joined us. If I'm not mistaken, he's the head developer of Medexis. So if you've got very technical questions, well, he'll be happy to answer them. Per, we have other questions. Perhaps you and Ed Monchen, who just joined us as well, who's the CEO of the company, might also be able to answer these questions. It's related to what you just mentioned about the system. Someone would like to know how much it costs to deploy this tool, and also an estimate of the annual fees per facility per user. Could someone provide some information about that? If you want me to repeat the question, don't hesitate to let me know.
Yeah, this is Ed Monchen. Hi, everybody. Yeah, I think we have a pricing list, of course, per health facility, and the perpetual license is typically around $250,000 a one-time fee. So that's what you pay once, and then you don't have any costs. Of course, you get all the upgrades for that amount. So if you compare it to open source, which often looks cheap, but you still have to do a lot of development work yourself. Yeah, you have to do the local install. You need to keep it in sync with future upgrades. So I think our model is pretty attractive because you get all the upgrades of the product while you have paid it once as a country and get an unlimited license to use the system. Per, I don't know whether you want to add some other things.
No, nothing further.
Does it answer the question?
I think so. Yeah, thank you very much, Ed. Next one, we have lots of questions coming up. Let me tell you about the next one. Next question, along with vaccine stock, does it cover the inventory of cold chain equipment on real-time basis? Installed, functional, under repair, beyond repair, condemned, age-wise, type-wise, etc.
I think I can answer that one. Yeah. Well, the short answer is yes. I mean, so your equipment, your stock of equipment, you enter each individual freezer or fridge in there and with its location and the status of it. That means also like the installment year, as far as I remember. So the year it's installed, the status of it, the brand and so on, also to manage actually the spare parts and so on. So yes, you will have an overview over your cold chain equipment and its capacity and age and so on, so you can manage that side. Over.
Thank you, Per. Next question. What other countries are using have used Medexis for which products? So I don't know, perhaps Per or maybe Katie, who's program manager.
Yeah, we started in Burundi, and we are now starting to implement it in Mali as well as a background system. We are talking to Ethiopia in the last mile in certain regions. So it's a system which has been introduced 2-3 years ago. So yeah, we hope to install it in many more countries in the next couple of years.
Thank you, Ed. Could you perhaps tell us for which products?
Yeah, I think Landry has the exact names. It's family planning products, vaccines, but Landry, you know exactly which products, right?
Yeah, correct. Exactly. So it was globally, actually RH product, reproductive health products. And then I can name one if you want. Yeah, for the condoms, for example. And then also a nutrition product that was the plumpy nuts. You remember those plumpy nuts for?
Indeed, yes.
Is that correct? So these ones, and then vaccines. Vaccines is the BCG, the common one. Yeah, we using actually here. So it was 9 vaccines in total. Yeah. Thank you.
Excellent. Thank you, Landry.
Yeah.
All right, we have many more questions, and we have a fan here, Annabella. Very interesting, the rideshare solution. How have you managed regulations for private drivers to manage public goods? In some countries, government has limitations on private sector to manage public goods. Thank you.
Yeah, let me say this is something we started actually. Yeah, it's important to mention that as well. We started, and then we thought about that as well, and we discussed even this with the MOH, and the way we did it is that we let the health facilities to choose the drivers, from private sector. They trust, because it's about trust. Yeah, and then they chose that, and then we are going to work with them. Yeah, and then that's it.
Thank you, Landry.
And maybe nice to add that those drivers will get a rating. So if they do their job well, they get a higher rating. So they are stimulated to do a good job, and you know which ones are better than others.
Correct. Yeah.
Okay, great. Next question. Can you also expand on how the rideshare solution integrates into Medexis to monitor distribution, or is it a separate APP? Landry?
I can take this one. Yeah, it's a separate APP, but then plug into Medexis as a new module actually. But we can of course take it alone, and then if, for example, there is another eLMIS in other countries, that's also possible.
Great, thanks, Landry.
Yeah, so I think I could add. So the idea with that one is actually not to limit it to Medexis. It is to use it in other contexts, and also, well, with a number of different LMISs, whatever there is. Over.
Great. Next question from Lokesh. Hi, Lokesh. Is the mobile application, sorry, let me read that again. Has the mobile application facility to record data offline too, or only online while having the network? This might be a question for Nuno.
I can answer that one. First of all, good afternoon to all of the participants, and thank you for taking the time to join us. Yes, the both Medexis web app and the app for mobile can work offline, and data is stored in the internal databases and then synced automatically as soon as internet connection is available.
Great, thank you. I hope it answers your question, Lokesh. An interesting question on data security. The data security has always remained major concern. Is there any possibility to host the data on government server? Maybe Nuno or Per?
Sorry, yeah, I can take that. The answer is yes. If the choice is to host the data on government server, it's absolutely doable. We would then probably like to have a solution where the data is on the government server, but the software is operated from the cloud. But we can work with various options, the needed options there are. Over.
Great, thank you, Per. We've got plenty of questions, so I hope you've got time. You've got time, you guys. Are you planning to use Medexis for the rest of the health products, not only reproductive health, vaccine, and nutrition?
Yeah, I can take this one. Actually, the work we've done, and then also the contribution of other stakeholders stimulated actually the government of Burundi here then to issue an RFP. They have an RFP actually to select then an integrated system whereby which will actually manage all these products. So we did apply for that, and then we are in the process. So we are just waiting actually for the outcome of that RFP. Yeah, but this is the intention actually of Burundi to have it to have all products integrated in one system. Over.
Great, thank you very much. I see there are also like there are some conversations in the chat. Jamini is asking if the tool is a fully compliant system. and if there's any recognition gained so far. I'm not too sure if I understand this question, but perhaps you guys can tell us more about that.
I think Nuno can tell a bit about security. That's one of the benefits of a cloud-based system, of course, that the security is centrally organized. So we do have ISO standards as well. Nuno, do you want to come in on this?
Yeah, we are currently under evaluation for the whole system by an external entity to ensure that every piece of Medexis is as secure as possible. And we are working together and all days to increase security and to prevent any data leakages and things like that. Yeah.
Thank you very much, Nuno. Yeah, that's it. Okay. Another question from Yogesh. In what terms context LMIS differs from WVSSM? Or is there any possibilities of integration like DHIS2?
No. So yeah, we definitely are integrating with DHIS2. So yeah, we can integrate, and Nuno can also talk on this with any other system through APIs. So to programmable interfaces. So I think we are very well positioned to integrate with any system, whether it's an SAP system, a data warehouse system. So the architecture is well suited for that.
Anything you would like to add, No?
Yeah, correct. It's Medexis is this new version is prepared to integrate with any other platform directly via or through API calls or manually, let's say. So import data that it's exported from other platforms, and we can create all of those import processes and validation processes.
Thank you very much. So we have an anonymous person who's asking, what are the electronic tags for monitoring the vaccines? Can all applications be available?
So this is Ben. I think I mean, the thing about monitoring vaccines is that there will be electronic gadgets on some of the cold chain equipment. It's so-called RTMDs, and of course that can be monitored, that can be connected to the software. If the freezer or fridge do not have that gadget on, you cannot monitor it from the software. It's not possible. But you can still have the software mapping out how much of hardware you have where, how old it is, and so on and so forth, so you can monitor the status of it. If that's that might be an answer to the question. It might also be an answer to say that you can have, if you have, you of course have GS1 coding on the vaccines, and that you can register in the system, and you can follow and track the products as they move down the supply chain. Over.
Also, one important part is that Medexis is prepared to manage VVM status throughout the cold chain.
Okay, thank you. Next question. Well, first, this question, the Sean is telling you, thank you for this excellent presentation, and I agree. Relating well with the Burundi presentation with ours in Zimbabwe. In Burundi, what is the internet coverage among health facilities, and to what extent is your eLMIS operable offline? Landry.
Alex. So in Burundi, we have 2G everywhere, minimum, or 3G also in everywhere. And then Medexis is designed actually to operate and function even at 2G. Yeah. So as soon as the antenna is available, then data can be synchronized without any problems here. Yeah. But the coverage, internet coverage is high here, I can see. Yeah. Over.
Yeah, so very simply, if there's an interruption of 2 hours of the connection, the system locally stores the data, and as soon as there's the connection back, the data is transmitted.
Yeah.
Excellent. Thank you very much for this answer. How does Medexis differentiate from the other eLMIS all around the world? That's a difficult one. What makes you unique?
Well, I think this system is one of the newest ones, so it has a lot of the newest features. I think what makes it unique that we offer this perpetual license, so you get all the upgrades in the cloud while you don't need to install anything yourself. I think the security, which becomes more and more important, you can never have that security yourself, or you must spend a lot of money on your local installations and security staff. So you get a lot of centrally hosted benefits while you still have a system which you can use in remote areas, in even offline settings. And then it has a very rich functionality, I would say. We spend a lot of time, well, we more or less put our 15 years of experience in dealing with supply chains all into the system. So yeah, if you get a full demo, it takes maybe 2 hours to really run through all the different functionality we have. So it's a rich system, it's a robust system, it's a secure system, and it's an affordable system.
Exactly.
And I might also say that I think
okay, go ahead.
I might also say that I think the cold chain management part is probably pretty strong compared to this, at least some of the others, I think. Yeah, we have that's pretty deep, the cold chain management part, equipment, vaccines, that kind of things. Over. Something?
Yeah, and then what I wanted to add as well is that we design Medexis from the end user perspective, you know. Yeah, that's what I wanted to add.
And agrees.
Oh, yeah, Landry stole mine. So
Yes.
I was about to point that because all of the development, and especially on the front end, so the part that the user operates, was carefully designed to be as simple as possible and to make it very intuitive for a user that doesn't necessarily need to have long hours of training before operating with Medexis. I think that is one of the key factors that differentiates Medexis. Yeah.
Thank you, Nuno. And you're talking about training. I would like to ask this question: do you offer training, or how does it happen? How do you organize training and the training for users?
Yeah, I can take that one. First of all, what we do is that we train masters and then master users. And then those are people we have also in our team. And then we have also in at MOH. So we put them together, we train them, and then they train themselves. Then they train the others, other trainers. And then it's sort of cascade training we do actually, so that people train their peer-to-peer trainings. And then we have set up WhatsApp group as well. And then where if they have an issue, they just drop the question there, and then anyone can answer them, or if possible, then we call them actually to guide them through the system. Yeah. That's the way we do it. And then we have tutorials as well. Thank you.
Yeah, and on top of it, we have an e-learning platform where we can train the end users through e-learning.
Okay. Excellent. Thank you. I have another question about access. If the system needs internet, how can the system work remotely in remote areas where internet is not available? Perhaps Landry, you have experience with that, no?
I do, and then I think I will maybe let Nuno first, and then say something, and then I will add.
So the technical answer from Nuno.
Yeah.
Okay, so in this new version of Medexis, we are using the latest technologies. So basically, you need to get the first initial login and work online, and then you can start working offline with the platform, knowing that from time to time you need to take or to have internet connection to just sync all of the data that you have stored in the in offline, and also to retrieve all of the data that it's available in the cloud servers. Yeah. Landry?
And yeah, what I wanted to add also, and which helped us here, is that motivation. You know, we had motivated end users. You know, because sometimes they were, when they were experiencing internet connectivity, they just go somewhere with their motorbike, you know, and then with the computer to capture internet and then to register. So by the day after, by 10 o'clock the day after, then you have the record in the system. Over.
This is excellent. Well, a general question, could we receive a copy of the PowerPoint? Of course, we're going to share the presentation as well as the recording of this presentation. And the next question, what kind of challenge? We actually received two similar questions. What kind of challenges did you have during the entire process? Also something about, yeah, the challenges during the implementation process. So Landry, perhaps you were firsthand in this in Burundi.
Yeah, thank you, Alex. The first one I'm thinking about right now is computer literacy. Mm-hmm. You know, and because we had, for example, a really motivated responsible pharmacist, but who of 55 years old, but who never touched a keyboard before, you know, but he wanted to do it, and so we had to discuss with his chief nursing, and then who accepted actually once he has everything on paper, that the chief nursing then was actually keying the data into the system. So that was one of the challenges we had. And then resistance to change, I would say, is we foresaw that, yeah, but with the extent, it was not so difficult for us, because we had developed also change management components, you know, whereby we really assist and then guide through, and so that you know, somebody, for example, who have been working for 20 years, a mama, for example, you know, who has been working for 20 years, asking her to switch from a paper-based to computerized, yes, solution was difficult. So we had to help her going through that process, and it works. Yeah, so that was the challenges I could think about. There are many, but I can stop here right now. Yeah.
Excellent, Landry. As a former change manager, I can really understand what you're saying. Great. We have other technical questions. Perhaps that one is for Nuno. Which cloud providers are you using? Is it allowed to store countries' data on cloud?
Yeah, we can use any cloud provider, actually. So it really depends on the country needs to then jointly decide or where are the country more comfortable in storing their data. But we can work with any cloud providers as long as they provide the security that we need to ensure for these kind of platforms.
Mhm. Thank you. This one is probably for Ed. Do you have representative in Somalia, or do you want to implement this helpful application in Somalia?
Yeah, thank you. We're definitely interested to implement it in Somalia and in any other country. We don't have representation ourselves, but we always work with local partners, so it is possible. So just reach out to one of us, and then we can talk about it.
Okay, I will share the. I will send an email to all people, to everybody who registered, with the links as well, with the links to the recording and the presentation, as well as an email address if anyone would like to contact you.
Yeah, thank you.
Next question. We have so many questions left. Is it only DHIS2 at the last mile, or can Medexis be used in the last mile too?
Yes, I can take this one. Medexis can be used in the last mile. Yeah, even down to community level, you know, community health workers, they can also use Medexis. That's possible.
Excellent. Next question. Does yeah, I think you somehow answered that, so perhaps you can confirm, Landry. Does Medexis have on offline capability everywhere? By everywhere I mean at all levels of the supply chain.
Yes, correct.
Okay, good. Thank you for confirming. Next one. What are the electronic? Well, I think we answered this one. Sorry. They were those questions were asked on the two different places. Question for Landry. It's more of a contextual question. To expand Medexis, are you doing advocacy or partnerships with local internet providers to improve internet service in remote area? A challenge everywhere.
Yeah, actually, yeah. There are few network companies here, you know, but only one seems to be everywhere, is that Lumitel one. So then what we now seen, we now exploring actually, or we gonna explore actually another possibility with that application we talk about, you know, so with a QR a code system, and then to see how far we can get to first with that one, and then if possible, then it's also possible to enter in discussions with local network and then see how they can actually extend their services to a certain area. But again, is infrastructure related, right, in country, right? Thank you. Over.
Thank you, Landry. Another question. What steps would you see when implementing it in another new country? So anyone who's responsible for implementation here?
Katie is in the call, she can answer it, but we have a methodology for the whole implementation process. Is Katie in the call?
Yeah,
she is.
Yeah.
Yeah.
Maybe I can start.
Yeah, Landry, you start, and I can chime in.
Okay. Let me start, and then yeah. Okay, so in country implementation, I think you first need advocacy, you know, central advocacy and alignment. This is where you have the buy-in of all stakeholders, you know, and then thereafter you may need some hardware procurement as well to have, yeah. And then this is where you decide, are you going to procure laptops or tablets or telephones and things like that based on the requirements. And then thereafter comes in your system configuration, actually. Yeah, whereby you put everyone together to make sure that you capture and configure as requested. And then another one may be interoperability, then seek interoperability with other ERP systems, you know, which might be in place as well. And then you will have the rollout after. and maybe maintenance if you opt, for example, for a local server or even data storage somewhere. You will have to have maintenance after that rollout, you know, and then the handover also, because at the end of the day, you're doing that actually to hand it over to the MOH, to the principal recipient. So this is what, out of very quick, yeah, what I can say actually. So, Katie.
Yeah, I think you covered it. You know, we also do, you know, pilots. It sort of depends on stakeholder engagement, what a specific country is looking for. So if they want to pilot the system in a couple of districts and a couple of facilities, we can start there. We also do, of course, user acceptance testing. And as Landry said, yeah, we can also help with rollout, implementation, change management, and then handover once everyone is set.
Great. Thank you, Landry and Katie, for this. Another question from Aun. Will the application work with other languages than just English or French? I mean, in general, how many languages do you support, and do you have intention to expand?
Technically, we can add as many languages as we need. We just send the translation file and get the new language and integrate it in Medexis. It's just a couple of days to implement new languages.
Okay.
Yeah, we currently have French and English.
Great. Okay. Other questions. Can the warehouses be managed? If there is any warehouse management? Landry?
Do you know?
Yeah.
Do you know?
Yeah.
Yeah, Landry, do you want to say something, or? Yeah, I would say
go ahead. Go ahead first, and then yeah.
Yes, you can manage the whole warehousing process through Medexis. Yeah, Landry, do you want to point out any specific?
Yes, actually, yeah, you answered that already. And then what we do actually also at facility is that we have then the main store, you know, and then also we have bin locations where you can then transfer products from that main pharmacy to bin locations to dispensing. Thank you.
Okay. Sorry, I think we are actually 3 minutes after 4. There are some remaining questions. I'm fine to carry on for another few minutes if you are available. It's really up to you. I mean, if anyone in the team needs to go, you can go. We can carry on for a few minutes. Would you like to carry on so that we answer as many questions as possible?
Yep.
Yeah. Okay, great. So there's
No
a lot of
problem.
interest, as you can see. Okay, this one. This might be for Nuno because I don't understand it, so it's probably technical. How would we integrate with the IP's LMIS?
Sorry?
Yeah, how would we integrate with the IP's LMIS? IP, like the 2 letters.
Yeah.
IP's LMIS. If it doesn't ring a bell, we can take another question.
No, not really.
Okay, good. Well, let's take another question then. I didn't understand it probably because it was not properly formulated. Usually, these systems are driven by donor funding. How do we ensure host governments take over the financing of these systems? And I think you answered that with the renewed Ed. You can
Perpetual license, yeah.
That's right. That's what I was looking for. Thank you. So this, once you have the perpetual license, then you have the license and you can keep the product.
Yep.
Is the solution program specific or inclusive of essential medicine, lab reagents, and other commodities?
Yeah, you can manage as many programs as you need or like. So there is not a limitation on that part. Yeah.
Okay.
You can run up to 20, 100 programs if you have them. Yeah.
Great. Every RTMD has got its own cloud server. So the integration possible is providing the link of that particular web-based application, isn't it? Or is it through another mechanism? Nuno.
Yeah, in this case, every device has, when you create a new device in the system, there is an option for you to add the URL, so we can retrieve the data from using that URL and get all of the sensor data that the device is sending.
Great. So the same person is saying that it's good to know that the application is Android based. Is it also compatible with iOS?
Yes.
Of
So
course.
as I said earlier, we are using some new technologies available in the market. So all of we can make the app available in any mobile platform available. So
Okay.
Android, iOS, Windows Phone, which is more or less residual, but even that we can generate the app for it.
Great, thank you. I think we've got a clarification of what IP means. If you remember the question I asked a few minutes ago. Thank you, Frank, for clarifying that. How would we integrate with the implementing partners LMIS? That was the question.
Okay, so technically it's just a couple of meetings and decide how the data is available on the other side or on the other platform, and then prepare all of the work to retrieve and process that data so it can be saved and used in Medexis. But that is the technical answer to it. I'm not sure if Ed or Landry want to point out anything else on that.
Yeah, I think, of course, there's a lot of organizational talking necessary, but yeah, I think you answered it technically, and that's probably the question.
Okay, thank you. Next question. This one is very broad. What would be the disruptive technology trends for future eLMIS?
Well, I think indeed our vision is that you need to go to countrywide control towers where you integrate a lot of different systems. And Medexis could be the backbone for such a control tower. It could be another system where we integrate with. But I think if you want to optimize a supply chain, you need to have end-to-end visibility. Therefore, the integration with DHIS2 is very important, so you know it from a patient angle as well, up to the central medical store, whatever system they use there. But at the end, you need to integrate it all to be able to optimize the supply chain. And then you can do some data mining and some more data analytics stuff as well on top of it.
Interesting. Thank you, Ed. Another question on bullwhip effects. How can the LMIS assist on minimizing bullwhip effects?
Very good question. Well, that's a bullwhip effect is, for people who don't know, is that you get a lot of like traffic, you get a lot of things which add up. So if you're able to oversee all the different actors in the supply chain, you know where there's overstock, you know where there's stock outs, you know where the demand is, so you can better plan and prevent bullwhip effects. And that's why I think Medexis is an excellent tool to do that with the dashboards and the management information you have. But first of all, of course, you need to have the raw data from all the health facilities and the warehouses and the manufacturers and the logistical actors to understand how the goods are flowing. And then you can prevent it.
Good.
And we do some modeling on this. We have some partners who do data modeling on supply chain. So if you're really interested, we can also talk about that and see how you can lower your inventory levels and optimize your whole supply chain, the cost of ownership.
Great, thank you, Ed. I think we have two last questions. Do you have experience of using your system in monitoring COVID-19 laboratory commodities?
Not for lab, I think. No, for vaccines it's possible, but for lab, no, I don't think we have PCR tests or whatever in it. But it's possible, but we don't have it.
Okay. And the last question I see, what kind of services gets covered in the subscription? Basic, additional, optional, on request?
No, it's a full license, so you get all the upgrades and all the support. So yeah, you get the latest version, and if you stay in the cloud, which we advise for security reasons and easier upgrades, it's like your phone or your computer, you get the latest upgrades automatically, so you can benefit from those. So there's no silver or gold difference.
Just one license.
Yeah.
One full license.
Our mission is really to provide the best affordable LMIS. We are a foundation, so we're not a commercial organization. And we really see the unmet need for these systems, and that's why we want to provide it at a reasonable cost, and don't want to make a distinction in the level of product you get.
Great, thank you, Ed. I think we've answered all the questions. That was a lot. I don't know. Yes, I would like to thank you for your time and engagement. That was great, and I think there was a lot of interest. We're going to share all this information with everybody who registered for this webinar session, because many haven't been able to join. As a reminder, so we'll send all the links by email, and it will be also shared through the TechNet 21 various channels. You can already register to our next session next week with the Open LMIS. If you're interested, I will send the link also by email, but it's also now in the chat. And thanks again, Nuno, Ed, Landry, Katie, and Per. And I wish you all a very nice rest of the day. Thank you, guys. Have a nice day. Stay safe.
Thank you, everyone.
Yeah, thank you.
Thank you.
Thank you for organizing.
Thank you. Bye.
Thank
Bye.
you. Bye-bye.
Bye.
Thank you.